In this podcast, we're going to be thinking about the ABO system of blood grouping, and we're also going to include the recess factor in that. Now, people can be blood group A, blood group B, or blood group AB, or blood group O. They're the four possibilities. So you're going to be A, B, AB, or O. Now, in addition to that, there's a recess factor. And the recess factor is an additional factor that goes with those four groups. It's an additional factor to those four groups. So this means that you can be A with the recess factor or A without the recess factor. If you're A with the recess factor, you're A rhesus positive. If you're A without the recess factor, you're A rhesus negative. And it's the same with blood group B. You can be B with the recess factor or B without the recess factor. So you can be B rhesus positive or B rhesus negative. So you can be A pos or A neg, B pos or B neg, B positive or B negative. And it's the same with AB. You can be AB positive or you can be AB negative. And it's the same with group O. You can be O negative or you can be O positive. That describes the 8 possible blood groups under the ABO rhesus system. Now, there are more blood groups than that. They're less significant than that. The ABO system was the first to be discovered, then the rhesus factor was discovered. Since then, extra blood groups have been discovered. So if you send blood to haematology for cross-match, the clever people in haematology know about more groups than we know about, and they can actually make the blood much more specific, accounting for more groups. But the ABO rhesus system is the essential safe clinical system that we need to learn about. And the absolute key fact to grasp when you're learning blood groups is that the blood group is on the red cell. So these blood groups that we've talked about, A for example, is actually a specific shaped protein molecule on the surface of red cells that gives them blood group A. And it's the same for B, it's a specific protein on the surface of the red cell. And it's the same for AB. AB contains A proteins and B proteins. So it's a kind of a combination group really. So on the surface of your cell you can have A proteins, or if you're blood group B you will have B proteins. If you're blood group AB you will have A and B proteins. And if you're blood group O, you won't have O proteins on the surface of your red cells, because O actually originally meant 0. So blood group O is actually blood group 0. The O is a corruption, really, of the 0. So in blood group O, you don't have any of these blood grouping antigens on the surface of your red cells. Whoops, I've said the word antigens there, haven't I? We call these proteins antigens. So we have A antigens or B antigens, A and B antigens together, or no antigens on the surface of the red cell. And in addition, there's a specific protein called the rhesus factor. The rhesus factor is so called because it was first identified in rhesus monkeys. That's why it's called the rhesus factor. But that is an additional cell surface protein in addition to A and B, or A and B together. So why is it that we call the proteins on the surface of the cells antigens? Because an antigen is anything the body recognises as being foreign and will make antibodies to. Well, the reason is that this physiology was worked out originally, actually way back in the 1920s, but it was worked out to facilitate blood transfusion. So if I am blood group O and I get some blood group A, that means I'm getting blood group A proteins in my body. To me they're foreign. So to me they are A antigens, and I would make antibodies to those because I make antibodies to proteins that I recognise as being foreign. So we call them antigens. So the blood group is determined by the antigen on the surface of the red cell. A has A antigens on the surface of the red cell, B has B antigens on the surface of the red cell. AB has A and B antigens on the surface of the red cell. And blood group O is actually blood group 0. It has neither A nor B antigens on the surface of the red cell. And in addition to that, there can be the rhesus factor antigen present or absent as well. Now, to understand blood groups, as well as understanding what antigens there are on a patient's red cells, we also need to know what antibodies there are in the patient's plasma. And these antibodies are described as naturally occurring antibodies. The child actually develops them in very early life. And what you have is whatever antigen you've got on your red cell, you've got antibodies to the other groups in your plasma. So, if you've got A antigens on the surface of your red cells, you will have antibodies to the B antigen in the plasma. So the package with blood group A is you get A antigens on your red cells, obviously, because that is what determines the group. But as well as that, you're going to have B antibodies in the plasma. So blood group A antigens, B antibodies. But if you're blood group B, you will have B antigens on the surface of your red cells, obviously, because that is what determines the group. But as well as that, you will have antibodies to the A antigen in your plasma. So if you're blood group B, you've got B antigens, and floating around in the plasma, you've got A antibodies. Now, if you're blood group 0, that is blood group O, you will have antibodies to every antigen you don't have. And if you're blood group O, that is blood group 0, you have no antigens. So that means if you are blood group O, you will have A antibodies and B antibodies in your plasma. You'll have both. Then finally, if you're blood group AB, you will have A and B antigens on the surface of your red cell. You're going to have both. And because you only have antibodies to antigens that you don't have, then that means because someone who's blood group AB will have A and B antigens, that means they will have no antibodies in their plasma. So if you're blood group AB, you will have A and B antigens on the surface of your red cell, but you'll have no antibodies in your plasma. Now, if someone who is blood group A donates blood to a recipient who is also blood group A, that's going to be fine, because they'll have A antigens in the donated blood, and there'll be B antibodies in the recipient's plasma. But that's okay, because the B antibodies won't react with the A antigens, so there's no problem. And it's the same if someone who's blood group B gives blood to someone who is also blood group B. The donated cells will contain B antigens, the recipient's plasma will contain A antibodies, and there will be no interaction with that. But let's suppose someone who is blood group A gives blood to someone who is blood group B. Now in this situation, you're giving group A antigens on the donated red cells, but there's going to be lots of A antibodies in the recipient's plasma. And what will happen is the two arms of the A antibodies in the recipient's plasma will both stick onto antigens on different red cells. Therefore, one A antibody can clump together two A antigens on the donor's red blood cells. And when you've got lots of antibodies, this means you can agglutinate lots of red cells together. So in a transfusion mismatch, you're initially going to get massive agglutination of the donated, in this case, A antigen containing cells with the A antibodies in the recipient's plasma. Because the recipient is group B, therefore they will have A antibodies in their plasma, and you will get agglutination. You'll get lots of little lumps forming in the blood, which of course is a very bad thing. It's like an intravascular coagulation. You're going to get lots of tiny little blood clots floating around that can block off small capillaries, such as in the kidneys, for example. small capillaries in the Gemelli can be blocked off. So that's a bad thing. But then over time these agglutinated red cells will be broken down by macrophages and monocytes, I suppose. And that will cause hemolysis. So you'll get release of the red cell contents into the blood. That's why this is sometimes called a hemolytic mismatch. But first there'll be agglutination and then there'll be hemolysis. But obviously this is a very bad situation. In fact, it is a potential life-threatening situation if we have a hemolytic mismatch. So for sure we can't give someone who's blood group B A donated blood. And I think you can probably see that the converse is going to be true. If we give someone who is blood group A B blood, then that will contain B antigens on the donated red cells. Those B antigens on the donated red cells will be agglutinated by the B antibodies in the recipient's plasma. And that's going to cause agglutination and a hemolytic mismatch as well. But if someone is blood group O and they give blood to someone who is group A, then you're not giving any antigens in the donated red cells. Therefore, there are no antigens in the donated red cells that can be interacted with by the B antibodies in the A blood group recipient's blood. So in theory, that's okay. And it's the same if someone who is O, blood group O, gives blood to someone who's blood group B, because there's no antigens on the donated red cells. Therefore, these antigens will not interact with the A antibodies in the B group blood recipient's plasma. So in theory, group O can give to anyone. This is why group O is sometimes referred to as the universal donor. It's not quite as simple as this because there are other blood groups to take into account, especially the rhesus factor. But let's carry on thinking about the ABO first. Now, if someone is blood group AB, they have A and B antigens on their surface, on their cell surfaces. So if someone is blood group AB and they give blood to someone who is group A, then the B antibodies on the AB donated red cells will interact with the B antibodies in the blood group A recipient's plasma. And likewise, if someone is blood group AB, gives blood to someone who is blood group B, the A antigens on the group AB donor's blood will interact with the A antibodies in the group B recipient's plasma. So we can't do that either. And if someone is blood group AB and they give blood to someone who is group O, then there are A and B antigens on the donated red cells to interact with A and B antibodies in the recipient's plasma. So that would be an absolute no-no. We couldn't do that. But if someone's blood group A and we give their blood to someone who is blood group AB, then in that case there are no antibodies in the group AB recipient's blood to interact with the A antigen, so in theory that is permissible. And if someone is blood group B, again we're giving B antigens, but there are no B antibodies in the recipient's plasma, so again in theory that is possible. And if someone's blood group O, we've already said blood group O in theory is the universal donor, so if someone's blood group O, there are no antigens on the surface of the O cells to interact with the antibodies in the AB recipient's plasma, because there are no antibodies in the AB recipient's plasma. Therefore, in theory, AB is the universal recipient. So when we're thinking about permissible transfusions, we're always thinking about the antigens on the donated cell and the recipient's antibodies in their plasma. That's what we need to take into account. The antigens on the donated red cells and the antibodies in the recipient's plasma. That's the way to think about it. Now, we've said that the rhesus factor is an additional factor. So if someone's rhesus negative, there are no rhesus antigens. And if we give rhesus negative blood to someone who is also rhesus negative, their blood should contain no rhesus factor antibodies, therefore that's permissible. And likewise, if someone's rhesus positive, their blood will contain rhesus factor antigens, but in the recipient's plasma there will be no rhesus factor antibodies, so again that's permissible. So rhesus positive can give to rhesus positive, rhesus negative can give to rhesus negative. Now the thing about the rhesus factor is that there are no naturally occurring antibodies. So if you give rhesus positive blood to someone who is rhesus negative, then the first time you do that, that's not going to cause any problems because there's no antibodies there waiting to agglutinate the rhesus factor antigens. So that's actually okay, but when you give rhesus positive blood to someone who's rhesus negative, the rhesus negative recipient will produce antibodies to the rhesus factor, and therefore they will be sensitized to the rhesus factor. So that means that if they were to receive rhesus positive blood on a second occasion, there would be a hemolytic agglutination of the donated red cells. But if someone is rhesus negative and we give their blood to someone who is rhesus positive, there are no antigens in the donated blood to stimulate antibody development. So again, in theory, that is permissible. So what this means is that rhesus positive in context of the rhesus factor is the universal recipient, and rhesus negative is the universal donor in terms of the rhesus factor. So that means, in absolute terms, the only universal donor, when we take into account ABO and rhesus, is to give O negative blood, because O negative blood truly contains no antigens on its surface. So in theory, we can give that to anyone. And very occasionally, in absolute emergency situations, if someone's going to die if they don't get blood, we will give them O negative blood, although we prefer not to. But it can be done. We can give them O negative blood as a last resort. And that means as well, if we take into account the A, B, O and rhesus factor groupings, that means the only true universal recipient is someone who is AB positive. So someone who is AB positive can have any of the ABO groups, and someone who is O negative can donate to any blood group. So the true universal donor is O negative, the true universal recipient is AB positive. But having said that, the haematology labs do test for additional groups as well. So this is just kind of a fairly basic way to look at it. But what we always check when we're putting blood up in the clinical situation, as well as the patient's name and the expiry date, and as well as the lab reference number and all the other things we check, we should always check the ABO system, the ABO rhesus system. And I've never actually in clinical practice given anyone any blood that's not of the same group. So if someone's A negative, I've only ever given them A negative blood. I've never actually been in a situation where I've had to give O negative blood, because that's an absolute last resort. So with every unit of blood I've ever put up, as well as doing all the other checks, I've always checked to make sure it's got the same ABO grouping and the same rhesus positive or same rhesus negative grouping. Now, even when you've done that, we have to observe patients carefully in case they do have a hemolytic mismatch reaction. Patients always need carefully observed when they're receiving blood transfusions. Receiving blood transfusions.